everyone, and thank you so much for joining us today. It's a pleasure for me to be here, and I'd like to welcome you to today's webcast, and it's titled, Who Cares for the Caregiver? So just to get started today, a couple things before the webcast gets going. I wanted to mention that these webcasts are part of the larger joint initiative by the Government of Alberta called the Human Services Learning Series. For information about this series, you can check your emails for regular updates or go to hslearningseries.ca. You'll be able to pose questions to me directly via our live chat window. If you have yet to access the chat, I recommend you try it now. All you have to do is scroll down from your viewing window to find it. And I'm going to address as many of those questions as I can at the end of the presentation. Paige Boudreau is our online moderator, so we welcome her. She's going to pose the web chat questions to me at the Q&A period at the end. Today's session is also being recorded, so the video will be posted at the hslearningseries.ca website in about 2 weeks or so, and you can certainly view it then. So now let's get started today. So again, this presentation today is called Who Cares for the Caregiver? My name is Debbie Cameron-Laninga. I'm the Program Coordinator for Caregivers Alberta, and I'm here to share a bit about caregiving and a bit of my own story. So that's actually what we're going to start with today on the webcast, is I'm going to share a bit about my caregiving journey, talk about some of the challenges that are issues that are faced by caregivers, talk about our agency, Caregivers Alberta, our programs and services, and then I'm going to touch on self-care and maybe help define it and talk about what it is. So who are caregivers? I think that's the question that comes up, and there's a lot of misinformation about there. When we're talking about caregivers, we're really talking about the family and friends that step up to care for someone who has either an injury, an illness, or concerns around aging. So it's all those unpaid people, and the reality is that they're providing 80 to 90% of the care. So for example, you have all the people that are caring for elderly or aging parents, whether they have illnesses or not. You have all the friends and family that are assisting someone that has mental health concerns. You have all the people that are caring for an ill spouse with the variety of diseases and illnesses and accidents that are out there. You have the parents of children that have special needs or disabilities. So that's a pretty large number of the population. So when you're thinking about brain injury specifically, often their friends and family suddenly become the caregiver. And in some circumstances, it happens very quickly. You know, it could be a result of a car accident or even a slip and fall in the bathroom. And suddenly, you know, life doesn't change just for the person that's the patient or the care recipient. It changes for everyone involved, and especially for the caregiver. There's a famous quote from former First Lady Rosalind Carter. And she said that there's only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. It's one of those funny parts of, yeah, we sort of recognize it, that it might happen to us, or it's happened to friends or family or people we know, but for most people it's a reality. And we don't talk about it, we don't plan for it, we don't think about, you know, what would happen financially, what would happen career-wise, what would happen just in the larger scale if we did become a caregiver. We define a caregiver as someone who assists a family member or friend with challenges resulting from disability, illness, or aging. So it's a broad definition. So how did I come to be a caregiver? What happened in my situation? Well, my background is a little bit unique. I don't have a background in the medical field. I don't have a background in social work. My background is aviation. I became a commercial pilot at the age of 19, and that was my career goals. So I was going about my career, got married, and my husband and I were traveling all over the place for different jobs. And then we ended up going overseas, and I became a missionary pilot, and I was living and working in Papua New Guinea, just north of Australia. I'd been there for a few years when, out of the blue, I received an email from one of my siblings saying, "Mom and Dad have health concerns. Did you know?" Well, the truth is I didn't know. I talked to them regularly, but they hadn't said anything. They didn't want me to worry. I'm way over there. And my husband and I had a talk about what we were going to do, and we decided to come back to Canada, check in on my parents, and find out what was happening. We booked our trip and we came back, and we only planned to be for 3 weeks, but the reality was we'd become very good at crisis planning. So we talked about, well, what if it's one? What if it's both? What if it's serious? What if it's not? So we actually had some plans before we even set foot back in Canada. Within a few days of arriving in Canada, my mom had a seizure. She was taken to the emergency at the hospital. She was there for several days, and at the end of it, they said, "We're very sorry, but you have several tumors in your brain and you have terminal brain cancer." Of course, they referred her to the cancer clinic. That same week following, my dad went in for all of his tests. We were just trying to process what had happened to my mom. And through his test process, within days, we heard back, we're very sorry, but you have terminal lung cancer, and it's spread up through your bronchial area and into your vocal cord. My parents, when they went to the cancer clinic, were both given the very sad news that their prognosis for both of them was 6 to 9 months. So my husband and I were faced with some very difficult decisions. Do we go back overseas? Do we stay? We sat down with our whole family. I am the youngest of 5 kids. Everyone came together, we sat down with my parents and we had a discussion, and I could see that people were struggling. There was a lot of denial, there was a lot of confusion, and my husband and I, whether it was wise or not, we put up our hands and said we're willing to take on the role of caregiving. We took a leave of absence from our agency and moved into my parents' basement. Now, I knew it was going to be difficult. We talked about it. We knew there was going to be challenges. We weren't in denial. We weren't thinking that this was going to be easy. But we really had no idea how difficult it was actually going to be. For my parents, they both had a little bit of hoarding going on. We have, as I said, I'm the youngest of 5 kids, and we have a very complex family. Added to that, my parents had a company, a business they were running, and they were elderly. And you put all that together and you realize that you're not just the caregiver. You're the cook, you're the chauffeur, you're the cleaning lady, you're the pharmacist, the nurse, the social planner, you're the engagement person, you're handling all of their business finance stuff that they were doing before. So as my parents went through their journey of cancer, my dad passed actually quite quickly. The 6 to 9 month diagnosis was actually quite correct. At 9 months into his diagnosis, he became quite ill, and he went into hospice, and he was there the last couple of weeks of his life before he passed. My mom had a very different outlook, and she was a very strong lady. She lived for 2.5 years, so much longer than anyone could have predicted. With my mom, she had a fall towards the end of the 2.5 years, and she did go into a long-term care facility. And I continued to be her full-time caregiver there. And there's that misnomer that once someone's in a facility or a care place, that you stop being their caregiver, which is not true. The realities of my parents' illness was very challenging. Having 2 people in the same house that are going through cancer treatments is intense. My dad was going through chemotherapy at the same time my mom was having radiation. And neither of them reacted well to their treatment, so we had to deal with that as well. My mom actually had a seizure in the parking lot of the cancer clinic after a treatment. My dad had to discontinue his chemotherapy due to side effects. The strain and the stress that it put on my family was recognizable, as well as the strain and stress on my husband and myself. So caregiving is an issue. The reality is that caregivers often don't recognize that they're caregivers. They don't self-identify. Often they'll say, I'm just the son, I'm just the daughter, I'm just the parent, I'm just the sibling. They define it by the relationship they have with the person they're caring for. Once they identify that they're a caregiver, they still don't often seek supports for themselves. The reality is that they're so busy advocating, dealing with the care and navigating the system for their care recipient, that they don't have time to look at their own needs. And often we don't hear from them, and we realize they don't seek supports for themselves until it literally reaches a point of crisis. So how many caregivers are there? Well, the Canadian statistics, and these are from 2012, is that there was over 8 million Canadians providing care to a chronically ill or disabled friend or loved one. They are estimating that this has probably escalated a lot over the last few years because we do have an aging population. And they're saying that even in the province of Alberta, we have definitely over 600,000 caregivers. Cost of caregiving. So if the work that the caregivers are doing, they weren't able to do it anymore, what would it cost our system? Well, from 2009, the estimate that was done in a study was that caregivers are estimated to contribute more than 25 billion, that's billion with a B, of unpaid labor to the healthcare system each year. The estimates I've heard that they're saying we're getting up to the point now in 2016-17 of probably near the $35 billion mark. At some point in their lives, nearly half of Canadians have provided care to a family member or friend with a long-term health condition, disability, or aging needs. They often suffer in silence. You don't actually hear from them that often. I kind of joke that they're probably too tired to speak up for themselves. And the reality is that I think that if they actually had a voice and started to lobby and started to advocate, that it would change the system radically. One of the questions that's been posed to us and that we don't have an answer for is, what would happen to the health system if they all stopped caring? Well, I think there's a good likelihood that they would bankrupt our health system. Some common caregiver challenges. So what are the things they're dealing with? Well, the things that we hear regularly at our office, and some of the ones I dealt with myself, are things like handling negative thoughts and emotions, disturbed sleep patterns, the physical demands, barriers to social interaction, family dynamics and family difficulties, the adjusting perceptions of the relationship with your care recipient, navigating the system and services, and financial hardships. So let's take a look at a few of these. So what is the physical health impact of being a caregiver? Well, we recognize that it's stressful, and there's going to be stress-related illnesses, and it may affect your immune system, but how serious is it? Well, caregivers are at a higher risk for all kinds of stress-related illnesses. They have an increased chance of heart disease, high blood pressure, herpes, think about it, cold sores and stuff, when you're stressed out, they come out. Some types of bowel disease. If they're diabetic, often loss of diabetic control. Alcohol and substance abuse is more common. Weight gain and loss is more common. And then the immune system. For some caregivers, they find that whatever little cold and flu is going around, they catch it all the time. Or they don't catch it until they get a break, and as soon as they get a break, then they get hit with it. What about the mental health impact? Well, research has shown that caregivers are certainly at a higher risk of depression, anxiety, and stress. So what does that mean? Well, when interviewed, caregivers report feeling anxious or worried. More than half of them say that. More than half of them say that they feel tired, which is not that surprising. Over 30% of them say that they often feel short-tempered, irritable, or overwhelmed, and disturbed sleep patterns are very common. The fact is that their stress is often related to how many care hours they provide a week, and it makes sense. If you're helping out an elderly relative and you're maybe doing 2 or 3 hours a week where you run errands for them or help them with shopping, it's probably not going to be that stressful, although it might still be stressful. Then you look at somebody who has someone with a brain injury or perhaps Alzheimer's disease, that they're putting in 30, 40, 50 hours of care a week, their stress levels are going to be much higher. So what is the financial impact? Well, certainly the two biggest ones that we hear about and that we see are lost wages and out-of-pocket expenses. There was a study done in Canada that looked at caregivers and what are the out-of-pocket expenses, because we sometimes naively think that, well, we have, universal health care, so it must cover everything. Well, the reality is that the average caregiver puts out at least $300 a month out-of-pocket expense. So that's medications that may not be covered, home adaptations, transportation, parking at all these health facilities that charge for parking. And then for some caregivers, they're dealing with someone who's maybe not as close. So if you're traveling across the province to another province, start including airfare, yeah, the price escalates very quickly. Then the lost wages part. Only 1 in 5 Canadian caregivers receive any kind of financial help, so the vast majority don't. The other financial hardships they're covering, well, the lost income part. And I think people realize that's an immediate issue, but it's also a long-term issue. Those years of caregiving, you're likely not putting away money for retirement and savings. You may not have any income at all, so you may not have any CPP money going in. You might not have any RRSPs. So actually, a lot of caregivers don't realize it in the interim, but long-term, they may be putting themselves at risk for being in a situation of low income or poverty when they get older. So what are some of the negative emotions? Well, guilt, certainly, anger, grief and sadness, doubt and worry, isolation. Other ones that have come up are things like feeling very guarded or apprehensive, a lot of fear. The most common one on the list is guilt. And I find that really ironic because caregivers are often, going to extreme lengths and making a lot of sacrifices to care for a person, but they tend to feel guilty. And I've been asked, why do they feel guilty? Well, if someone that you care about is in pain, you automatically want to fix it. And if you can't fix it, you feel like you may be failing in some way. For other caregivers, they have themselves held to very high standards. They don't ever want to make a mistake. And they tend not to take breaks, and they tend not to take care of themselves because they feel guilty. Then you have the physical challenges. So you have lost sleep, extra chores, and heavy lifting. The lost sleep, I think, makes sense for a lot of people because you realize if you're caring for someone, it may mean interrupted sleep patterns. The extra chores is sort of hidden. So for a lot of caregivers, what they find is tasks that the other person used to do, they suddenly take on. So if the other person that is in the situation used to do maybe the finances or the cooking or the shopping or things like that, and they suddenly can't do it anymore, they now are taken on by the caregiver. I talked to one older fellow that was caregiving for his wife, and he came to some of our workshops, and in a side discussion we were talking about some of the challenges, and he said, the reality is my wife has always done the shopping and cooking. Our whole married life, she's done the shopping and cooking. Now she can't. So I've taken on the shopping and cooking. And he said, and it's been a bit of a disaster. And he sheepishly admitted that the only thing he knew how to make was pierogies. So they'd been living on pierogies for a couple of weeks for breakfast, lunch, and dinner, because it's the only thing he knew how to cook. And in a way, it's sort of funny, but it's also sad because you don't realize that, yeah, all those tasks and all of those roles that someone else used to hold, it often gets dumped on the caregiver. In addition to that, there's the heavy lifting. So the physical side of caregiving. If you've ever had to help somebody transfer from a wheelchair into a bed or onto a toilet, it's a lot of lifting. And caregivers don't always have the right equipment or the right training. Add to that, you have the lifting of any extra tasks. And what I was surprised by when my parents become ill was my mom ended up having to use a wheelchair. And I don't know, somewhere in my mind I thought wheelchairs weren't that difficult. The first time I had to put the wheelchair into the back of her vehicle, the first attempt I couldn't even fit it in. It was heavy, and I'm used to lifting. And then I realized, no, you got to disassemble it first. So by the time I was done, I thought, well, you either need to be a body lifter or an engineer or both. And I thought how ridiculous it was that we're asking people that are often frail themselves to be lifting these pieces of equipment in and out of vehicles. So all of those physical challenges certainly can build up and add to the stress. The difficult relationships. So it's that balance of time with the care recipient versus time spent with others. Now the reality is that anytime you're spending a lot of time with one person and not the others, that sort of feeling of guilt or there may be feeling of resentment or jealousy can creep up. If you're caring for someone with a brain injury who's perhaps your spouse, and you're not spending the time with your kids and or grandkids or your children that you normally did, that's going to weigh heavily on you. And that's often the case with caregivers, is any time that they're not spending with the other people in their life, they feel guilty, and it causes strain. From my own situation, certainly I was spending all my time with my parents and my marriage. My husband was like, where am I in this situation? Where do I fit in? The other thing we don't realize is that when you become a caregiver, it changes the relationship with the person you're caring for. If you're caring for a parent, my mom was a very strict lady, excellent mom, and I was used to her being the kind of mom that would, kind of mother you a little too much sometimes. Whenever you left the house, do you have your coat on? Even in your 30s and 40s, do you have your coat with you? So with my mom, that was our relationship, what I was used to. And then as she became ill, the tumors in her brain caused her to have some of the symptoms that would be similar with brain injury or Alzheimer's. And there was a day that she was sitting at the kitchen and she looked at me and she said, how do I take these pills? And at first I thought she was joking. Then I realized, no, she was serious. She didn't actually know how to take pills anymore. So I had to go through the process of explaining to her how to take pills. And at that point I realized I'd become more of the mother in the situation than she was. And our roles had kind of reversed. And that's very common in caregiving, is that you may take on more of a parenting role for your parents, or that relationship you had with your spouse. Maybe they're not able to be that person that was your friend or your confidant or your partner in life anymore, and you're now almost in a mothering or nursing situation for them. And then we have all of the people that are caring for children with disability and illnesses. It's not a normal relationship for parent-child either. I've talked to lots of caregivers that they've got a child who's now in their early 20s and they're still doing all of their care for them in the morning and the evening, getting them in and out of wheelchairs. Well, by that age, most people are starting to think of becoming more independent. So it changes those relationships. And then thinking about just how complex our families are nowadays. Canadian families tend to move around a lot. They're not always in the same city or province or even the same country. Families are getting smaller in general. And then like in my own case, I think about how complex my family was. It was a blended family. I have older half siblings. There's a huge age gap. All of those things come into effect and have a consequence on those relationships and can make them very challenging. Now that's not to say we don't hear from lovely families on a regular basis that pull together and work really well together around caregiving, but I would say that they're still in the minority. So system challenges. One of the things that I love about my job is I also get to connect with lots of professionals and other colleagues, peers in the industries. And I've asked them, social workers, nurses, health professionals, community outreach folks, do you know of all the programs and services out there? By and large, they say no. And I ask them, do you have trouble navigating the system? By and large, they say yes. So then it begs the question of how much more difficult is it for a caregiver to navigate all of the systems and variety of services that are out there? The reality is that with all of these systems and services, there's often methods to get into them. There's often assessments that are required. You may not qualify for everything that's out there, and even finding them. One of our sayings that's come from a lot of our caregivers is, you don't know what you don't know. It's not till further in you realize, oh, there was a support for that, or there was a system for that. The other thing we realize is that there's a real difference in Alberta between our rural caregivers and our urban caregivers. For some of the rural areas, there just aren't the supports available. For example, in the brain injury supports in Alberta, they're very regional. And what may be available in Edmonton may not be available or restricted to someone who's from a rural area. So, there's a wonderful concussion program here in Edmonton, but if you're from outside Edmonton, you may not be able to get into it. So it begs the question, who is Caregivers Alberta and what do we do? Well, we are a charity. We were started in 2001, so we just celebrated 15 years last year. And our focus is on the caregiver's needs rather than the care recipients. So our agency literally started out of the ashes of one caregiver's burnout. It was someone who had been in the health profession, and when their family member became ill, they thought, oh, I got this. I know the system, I can do this. But very shortly in, they realized they were becoming fatigued, burnt out, irritable, feeling guilt, feeling all these emotions, and wanted support. So when they started looking for support, they found that most of the caregiver programs that were out there were really about the care recipient. They were about their treatment, their prognosis, how to care for them. So when this person brought up, well, what about me? What about when I'm feeling sad or when I'm feeling frustrated? And they were told, no, there's no programs for caregivers like that. So the agency was started by a few little caregivers that were concerned about all the other caregivers out there. And our focus is really about the caregiver's journey, their well-being, and supporting them. The reality is that if we don't start supporting our caregivers, they're going to be our next patients. They're becoming ill at an alarming rate. They're burning out at an alarming rate. And we are the only agency in Alberta that's focused on supporting family caregivers. Our mission is to empower caregivers and promote their well-being. Our vision is an Alberta where caregivers are valued and supported, and I realize that's a very lofty goal. Our programs, we consider them to be informed programs and services. When the agency was started, because it was caregivers, it's a very grassroots kind of agency, and we didn't want to have a bunch of professionals and researchers and people sort of on top telling caregivers what they should do for themselves. We started off with some research projects. So we gathered information from hundreds of caregivers across Alberta, and we asked them about their lived experience. So the two studies we did was in 2002, we had one called Shining the Light. And in 2010, we continued our research with Mine, Yours, Mine, and Ours. And what we have done is caregivers tell us what they want. They tell us where the gaps in services are. They tell us what programs they want to see, and then we work to develop those. So we really do start from their needs and build up. So what are our programs for caregivers? Well, we have a workshop called Compass. I'm going to talk about that a little bit more later. We have our caregiver advisor and our staff. And we're really there to provide one-to-one support for caregivers. So they sometimes drop in, but more often they call us. And they call us often with a question or needing a resource or having a concern about something. And what we find is that we tend to ask them the next question. And how are you doing? And how are you feeling? And how are you managing? And what we find is that caregivers are often, I kind of think of them as like onions. So there's layers. So you'll find out that yes, they need that information about that resource, and you pull back that layer and ask them how they're doing. Well, they're not doing very well. And you pull that layer back and you find out, well, there's some financial stuff. And you pull that layer back and you find out that they may have their own physical or their own mental health concerns. Or you pull that layer back and you find out they've got family dynamics. So quite often we're there to support them, to give them resources and referral information, and to be that listening ear. We also have our caregiver information series, which I'm going to touch on a little bit more later as well. We don't just stop there. We also have programs for professionals. And we've been asked, well, why have we done that? Well, what we heard from the caregivers is those professionals don't get it. They keep telling me to take care of myself, and that's not what I want to hear. And then we hear from the professionals, whether they're in health or community or social services, we want to support the caregivers, we want to help them, but we don't know what to do. So we wanted to create some ways to bridge that gap. The ways we've done that is, first of all, we have a caregiver support team. It's our professional networking meetings. We meet here in Edmonton once a month, and there's over 40 agencies involved, and we realize caregivers aren't their primary client. That's usually their secondary client. And we come together to do education and support each other and to really just find out what programs are out there. We also have our Caregiver Navigator program. It's a one-day workshop. We have a wonderful staff member who's a former nurse, lots of experience. And she does the one-day workshop for basically anyone who finds themselves working with caregivers. So we've had people that were in rec therapy, occupational therapy, doctors, pharmacists, nurses, social workers, chaplains, you name it. They come to the course. And what they often do is they come in with this idea of, oh, I know what caregiving is. I know what caregivers are. At the end of the day, they often leave going, oh, I didn't realize all of that was going on. In addition to that, with our Compass workshop, we do train facilitators across the province to offer that program. So what is Compass? Well, the long explanation, or what it stands for, is the Caregiver Orientation for Mobilizing Personal Assets and Strengths for Self-Care. I don't get to say that very often. What it really is, it's a 9-module program. And it provides caregivers with the tools to better manage their demands and their unique challenges. It's facilitated by a caregiver or professional who's trained by us and understands how hard caregiving can be. Now, having said that, the program is laid out where each session builds on the previous one. It starts off with caregiver characteristics, so where are you in your journey? The emotional journey jumps right into what are the feelings you've got. Is it guilt? Is it resentment? Is it frustration? What's happening? The third module is the balancing act. So how do you balance things like grief with hope, and how do you balance the rest of your life with caregiving? Module 4 on improving communication focuses largely on how do you communicate with family and friends? How do you communicate with your care recipient? Then in the middle of the program, we get into putting yourself first. And I always joke that I could never put that session at the beginning because people wouldn't come. Caregivers don't tend to put themselves first. That's one of the problems. So in putting yourself first, we look at practical ways to do that without feeling guilty, and ways to start to introduce some self-care. Then we get into managing stress, recognizing burnout, and looking at some coping around that. Navigating the system and planning for the journey ahead comes at the end with a gathering session. Now that doesn't really explain Compass. The reality is that there's something quite magical that happens often in our Compass workshops. With the workshops, what I've found is that it's a safe place. So yes, there's a manual, yes, there's exercises, but the reality is when you bring caregivers together in this safe place where they can say whatever they need to say, and they realize they're not alone, they feel supported. Often when they come into our program, they're either very emotional or very tired or cynical or angry. I've even had people fall asleep in the first session, they were so tired. And when they come in, you can tell that they don't want to be told how to do it. They don't want to be told all the things they're doing wrong. They don't want to be criticized. About 2 or 3 sessions in, when they realize that this program is really about them. It's focused on them. It's focused on their well-being. It's about how to care for themselves. You start to see a change. You may see them sitting up a little bit more, or a little bit of brightness in their eyes, or somebody that maybe the first session wasn't looking all that much put together is suddenly looking, makeup's done and hair is done, or something like that. By the end of the session, by the end of the modules, you start to really see changes. People are laughing and joking, they're talking about things that they have for the future, for plans, and there's this hopefulness in them. I have one facilitator who she keeps asking me if she can take before and after pictures, and I've told her no. But she says you can literally see the difference in people from the beginning of the sessions to the end of the sessions. Compass is normally offered once a week for 8 weeks. Each session is 2 hours, so it is a big commitment. And caregivers sometimes say to me, oh, I can't possibly set aside the time. Well, here's the question. If you become sick, you become ill, and you burn out, what's your backup plan? Who is going to step in and take care of not only your care recipient, but you as well? So you must make the time for yourself. At some point, you're going to have to take the time to make that time for yourself, and Compass is an excellent way to do that. Now with the program, you can tell probably that I'm very passionate about it, I believe in it. And part of my role at the agency is I get to do the evaluation pieces. So I see the before and after evaluations, and I talk to a lot of the caregivers around the province that take the program. And for a lot of them, it's life-changing. I had one caregiver who had a very difficult situation, and in talking to her group, she had explained how the person she was caring for was literally building a brick wall down the middle of their kitchen. Because of their illness, it made sense to that person that that was a normal thing to do. So this lady at the end of every day was tearing down this brick wall with brick and mortar, carrying them back outside, and then cleaning the kitchen. And whenever friends or family or home care came over, she would spend 2 or 3 days cleaning like crazy so no one knew what was going on. The group that she was in Compass with, the other caregivers, had said, you know, don't keep hiding it. No one knows you're in distress. No one knows you need help. And for goodness sake, stop scrubbing on your hands and knees with a broom and a brush. Why don't you use a mop? Well, mop was not okay because that was below her standards. So when I called her a few months later after Compass to ask her how she was going, she went on and on about how great this mop was, and I couldn't understand what she was talking about until she explained the backstory. And she'd realized that she was holding herself to a ridiculously high standard and not letting people in. And Compass allowed her to let people in, to get more support and help, and to adjust and manage her life in such a way that it wasn't draining and leading to burnout. Now, in addition to that, we have our information sessions. We realize that not everyone can make it to a Compass group. It is a big commitment. So our information sessions are a safe place for caregivers to connect with other caregivers and gain practical knowledge and skills. Their presentation style, so it's not as much supportive and not so much sharing as our Compass group. But what we do is we pick topics that caregivers tell us they're concerned about. So we have topics such as managing stress, caregiver grief, time management for caregivers, conflict and family dynamics. We've even got we've got one called the Paper Dragon, which deals with all the paperwork that comes with being a caregiver, which the Office of the Public Guardian webinars and web series cover as well. So with these information sessions, we provide them here in Edmonton, but we also have partners across the province who are starting to provide them as well. And we're very fortunate here in Edmonton that we've also been able to open it up to guest speakers. So some of our guest speakers have included, we've had Alberta Health Services come in and talk about their services. We've had financial planners come in. We had some people from Meditation Center come in. We had a laughter yoga session, which was just a crazy hit. We even had a lady who has a pet, a therapy pig, come in to talk about how pets increase wellness for caregivers. And Sam the pig was a huge hit. So what are the consequences of caregivers not taking care of themselves? They often think if I just grit my teeth and I just keep going, I'll make it. But the reality is that they are at a high risk of becoming ill or burning out. So who will take care of them? There's some studies that have come out of the States that have sort of highlighted this for myself that I wasn't even aware of. One of the studies that I saw was that they looked at seniors who care for seniors. So somebody over the age of 65 caring for either a spouse or even more elderly parents. And they measured the mortality rate among these seniors. They found that the seniors that were caregivers had a 63% higher chance of mortality than their non-caregiving peers. So the reality was that the caregivers were passing away before their care recipient, and often due to stress-related illness. So how can you take care of yourself? What does that actually look like? Well, our programs and our services promote self-care. We divide it into 4 categories: physical, psychological, emotional, and spiritual. So self-care is not the things you have to do, like the shopping and the studying and the work and the housework and the caregiving. It's the things that you like to do, the things that re-energize you. So when you're thinking about the psychological stuff, that's anything that reduces your stress. So for some people it's meditation or yoga. For other people it's just deep breathing or just taking a break. The physical one, that's that actual taking a break. And it doesn't have to be long. It doesn't have to be weeks long or months long. A few hours off or a weekend off can be hugely beneficial for caregivers. The other side of the physical is caregivers don't tend to eat well. They don't tend to exercise regularly. They don't tend to sleep well. So looking at those pieces. The emotional self-care, that's that part of who can you talk to? Who's there to support you? How do you get your emotions out? How do you express yourself? The spiritual side, that's very individual, and we recognize that. For some people, it's certain belief or certain cultural practices or certain services they attend or books that they read. For other people, it's simply getting out in nature. There was a study that was done on the benefits of hugging a tree, and I'm not a tree hugger, but one of my staff colleagues is. And there's actually a biochemical reaction to hugging a tree, which I didn't know. So for some people, getting out in nature is very important. For other people, it's spending time with friends. It's the real question of what feeds you. It could be something creative, it could be pets, but what feeds you, what fills you back up? So where do you begin? Well, the biggest thing I recognize with caregivers is when I'm meeting with them, when I'm talking to them, when they're in our workshops, they aren't breathing. Let's start with that. They're often breathing way up high in their chest and their shoulders up around their ears, and they're very tense. So the first key is to just recognize you need to breathe. Slow down your breathing, take deep breaths, even if it's just a couple times a day, to recognize you really do need to breathe. Then what feeds you? What things are important to you? And I've had caregivers say, well, I'm not even sure. I'm not even sure what makes me happy anymore. Well, think about what used to make you happy, and that might give you some clues. We have a handout that we often give to caregivers called 101 Ways to Take Care of Yourself and Reduce Stress. And it's everything from taking some time off to small things like remembering to smile, writing stuff down, because when you're under stress, your memory can fail you at times. Learning to say no, and caregivers are notorious for not saying no. Little tips like petting a friendly dog or cat, or tickling or holding a baby, taking a break, doing something you enjoy. So those ways to reduce stress. So how do you relax? Well, caregivers tell us they don't. They don't relax. They don't take time for themselves. They don't take time because they feel guilty for it. I often hear caregivers say, you know what? The person I'm caring for is ill, they're sick, and how selfish would it be for me to take time off? Well, the reality is you need that time off so you can continue caregiving. Or they say they're too busy. And I get it. Caregiving is overwhelming. It can just immerse you. And then how do you get help with your care recipient? So how do you get someone to fill in? How do you get respite? How do you get someone to watch that person if you're the one that normally watches them? How do you get that help? But in the end, you do need to think about that time for yourself and relaxing. I've talked to caregivers that, because their situation, they really can't leave their care recipient for any length of time. The one lady that I work with, we came up with a solution of her walking around her house outside when it's not cold. So this week's perfect when it's nice and warm. She wasn't getting exercise, she wasn't getting outside, and she thought, well, that's kind of crazy. I'm just going to walk around my house. My neighbors are going to think there's something wrong with me. But the reality is, after a few times of trying it, she said, yeah, I do feel better. Just getting out for even a few minutes, I can still hear my care recipient, makes me feel better. And then that tip of think about what you were doing before you were a caregiver that made you happy, that filled you back up, that energized you, and start small. Laughter. Where is your funny bone? What makes you laugh or smile? Even a few minutes of watching a funny video or hearing a joke can make your day lighter. It's that idea that, that saying that we go back to, laughter is the best medicine. Well, it's rare for caregivers to laugh. There's some of them that are great at it, but lots of them sort of lose their sense of humor. And that's one of the things that our programs encourage as well, is getting back to that point where you can find those lighter moments of mood. Of course, studies have proven that when you're laughing or when you're joking like that, there's a release of the hormones that help to lower blood pressure and lower your heart rate. So it actually is directly good for your health. So touch. Caregivers spend a lot of their time and a lot of their day often touching their care recipient, but it's usually to assist them. So helping somebody get washed up, or helping somebody eat, or helping them transfer and move around, helping them with their walker, their wheelchair. But it's often almost business-like or clinical. So when I ask caregivers, when's the last time somebody touched you in an affectionate or friendly way, they're lost. When's the last time someone gave you a hug? When's the last time someone patted you on the back? When's the last time someone held your hand? Those questions are remarkable. We've had some caregivers recently that have, because the person they're caring for has become very ill, they tend to sit apart from them where they used to sit together, especially spouses. And when we sort of ask them those questions about when's the last time you gave them a hug or a kiss, they can't remember. And I think caregivers need to realize that they also need that affection in return. So I'm going to touch a little more about that connecting with nature. Just a few minutes of sunshine or nature can relieve tension. Of course, we know that it's a good way to get your vitamin C's and your D's, but certainly it can brighten your mood and lower your blood pressure. Just being outside for a short amount of time. And this warm spell that we've got is the perfect time to get out there. So what are some ways to get out in nature more? When I think back about when I was caregiving for my mom, especially when she went into a care facility, she was in her room a lot. So when the weather was nice, I would ask her, do you want to just go outside and I'll just push you around in your wheelchair? It was great exercise for me, but in addition, I could see that it improved both of our moods because that feeling of being sort of locked in and closed in that we both felt was relieved by doing that. So balance, that's a big question for a lot of caregivers. The reality is life doesn't stop when you become a caregiver. All the things you were doing before usually get piled on. Those statistics I mentioned at the beginning where there's over 8 million caregivers in Canada, 6.1 million of those still hold some kind of employment. So they're still trying to work. What I'm always surprised by is how many of those people work in health and social fields. So I talk to lots of people that are nurses and doctors and people in the health profession that they do professional caregiving, paid caregiving during the day, and then when they leave their work situation, they go home to be a family caregiver. And when I ask them, so when do you get a break? They don't have an answer. So all those other tasks, all those other relationships, they don't pause. So the bills still need to get paid, dishes still need to get washed, kids or pets need to be cared for. So how can you balance it all? And that's a great question because caregivers ask me that all the time. In some of our programs, we touch on that. So how do you balance it? And the key is, well, the first key is asking for and getting help. And I recognize caregivers are often very intimidated by that or they've had bad experiences, but finding the right supports, the right services, the right help can allow you to take some of that time that you need for yourself and for the other people in your life. So when you're thinking about trying to balance work and caregiving, that's one of the challenges we have right now in Alberta and in Canada. We talk about accommodation within employment, we talk about flexible arrangements, but the reality is the majority of caregivers don't tell their employer that they're a caregiver. Don't talk to them about, I'm a caregiver and what might that look like. What we find is that caregivers, by and large, use their vacation time, their sick time, and those days off that they're entitled to care for their caregiver. On average, they end up taking 8 days more on top of that per year to do the caregiving. So then they're dealing again with lost wages. And I realize not all employers are open to having that conversation. The agency that I work for is very open to it because we are Caregivers Alberta. But it's starting to talk about and talk with employers and talk about those people that are in charge. How do you support those caregivers? Because often research has shown that caregivers make some of the best employees. If you do support them, they're sometimes the most loyal and hardworking employees, especially after the caregiving situation ends. So thank you for sharing this time with me and viewing this webinar. It's been my pleasure to be here. And I hope it's been informative. I hope it's helped people. And certainly if you're looking for our services, you can search out Caregivers Alberta. But at this point, I was hoping to turn over to questions. And Paige, thank you for joining me today. I'm hoping that there's some questions that have come in over the webcast that we can touch on today.
Absolutely. So our first question today is, are there any financial programs available for caregivers?
Yeah, so that's one of the most common phone calls and questions we get in our caregiver supports is, are there supports for caregivers financially? And the reality is that there aren't a lot. There's a couple of benefits that have been implemented in the last few years. There's one called the EI Compassionate Care Benefit. Now the reality is only applies to caregivers that are dealing with someone who is gravely ill or close to death. And they had been defining it as if a doctor said the person was in the last 26 weeks of life, so death was imminent, they would be able to apply for the Compassionate Care EI benefit. In the province of Alberta, they also have passed legislation that protects your job for a portion of that. Now, unfortunately, that doesn't apply to most caregivers. So there's been the Caregiver Coalition, the Canada Cancer Foundation, and society have all been talking to the government and trying to change the policies. So originally the EI benefit was only good for 6 weeks. It's now good for 6 months. And we're trying to get the wording changed where it's not just for caring for a terminally ill person, it's for a wider range. My understanding is that that's a policy that will be coming in the future, but we don't have it yet. The other benefit that's been brought in is what's called the Caregiver Family Caregiver Tax Benefit. Now the concern with that is that you have to be working and you have to have a certain level of income to benefit from it, and the person has to live with you. So there are some caregivers that benefit from it, but there's lots that don't. So in terms of financial programs, there's not a lot out there, but certainly if people have further questions, they can contact our office and talk to our staff, because we do have that information. Thank you, Paige.
So our next question is relating to the training programs, and they're wondering if all the training programs are provided in Edmonton, or if there's workshops in other parts of the province as well.
Yeah, that's an excellent question. So the reality is that Caregivers Alberta, we are a small organization. We have on average 5 or 6 staff usually, but we are provincial and we are dedicated to that. So although we take calls from all over the province, what we've realized is that our workshops like Compass and our information sessions are no good to the caregivers outside of Edmonton unless we can support them as well. So what we've done is we've created partnerships and collaborations with agencies and communities across province. We have over 200 Compass facilitators at this point in time. And they're from everything from illness-specific agencies to healthcare positions. We also have lots of volunteers. And within those agencies, they decide how often to run Compass. So for example, one of our great partners is CABIS, the Central Alberta Brain Injury Society down in Red Deer. Some of their staff have taken the training and facilitate Compass at least a couple times a year. So those partnerships allow us to offer our programs in a wide variety of places across the province. Sadly, not everywhere, and we're working towards that. And certainly that is our long-term goal, is that every caregiver across the province will be able to access our programs.
Our next question is, do you have any advice for people who have someone in their life that is a caregiver and they can tell is struggling? How to support a caregiver in their life?
So supporting a caregiver in their life, so that's a common question. Is I know even myself, having been a former caregiver, when I see other caregivers struggling, I want to get in there and help them. And often when you offer them help, they're like, oh no, I've got it, I'm okay, I'm doing all right on my own. So some of the things to ask are specific questions. Can I prepare a meal for you? Can I bring over a home-cooked meal? Can I take your care recipient out for a walk or spend some time with them to give you a break? If you can think of some specific things, that often helps, because caregivers are so overwhelmed, they don't even know what to ask for anymore. And accepting help, there's that sort of that worry in our culture that if I ask for help, how do I have to reciprocate? Or what am I going to have to do back for you in the future? And we're not great at asking for help, and we're not great for supporting caregivers. So in our programs, we have a lot of tips and a lot of tools. One of the tools that I love is one of our exercises called You Asked For It. And You Asked For It is a list of all of the things a caregiver might need help with. So things like cleaning their house, or having some meals pre-prepared, or cutting their lawn, or removing snow. And the idea for the You Asked For It list actually came from one of our participants. We were in a workshop and talking about getting help, and everyone was saying, no, I don't get help. And this one participant said, oh yeah, I have someone who cleans my toilet. I've got another neighbor who mows my lawn. I've got a family member who cooks meals 2 or 3 times a week and drops them off. And we were all in shock. We said, well, how do you do that? She said, well, I have a You Asked For It list. She'd made her list, and on her list, she left space for people to put their name and how often they could actually do that task. So when those well-meaning people in her life would say, oh, well, I know you're caregiving, and if you ever need anything, just let me know, she'd pull out the list out of her purse and give it to them. And I thought, how bold is that? Because the reality is right there, you're going to know if they're serious. If they don't sign up or don't put their name down, they say, I got to check my calendar. They're not serious. It's a social nicety. What she was surprised by, how many people looked at the list, signed up for something, and took on some part of the caregiving. In a very short amount of time, she had several people doing several things. And what she found is first of all, they chose something they enjoyed. So for example, my husband would, he'd probably pick off the lawn mowing because he loves the smell of cut grass. I would not pick off the lawn mowing out of that list, but they picked out something they wanted to do to help. And I think we forget that around caregiving, there is something wonderful that comes from it. Today I've talked a lot about the challenges and the issues and the concerns, but the reality is that caregivers benefit by being caregivers. A recent study out of the United States asked caregivers that were finished their journey at the end of it, if you were to go back to the beginning and do it over again, would you be a caregiver again? Would you do it? 9 out of 10 of them said they would. When I think of my own situation, as difficult as it was, as challenging as it was, if I was presented with the same choice today, I would do it again. the honor and the gift that I gave to my parents is without price. And caregivers at some level often recognize that. There's something very human, something very life-affirming to be a caregiver and to share that experience with somebody, to go with that through the journey with them. So keep working forward towards that. Keep asking them, maybe specific questions of where you can help. But certainly our programs encourage that area of getting caregivers to accept help.
Our last question today is, how's the best way to get a hold of you to get more information?
Oh, that's an excellent question. So our agency is here in Edmonton, but we do have a toll-free number as well. If you're in the Edmonton area, you can call us at 780-453-5088. And most of our staff are current or past caregivers, and we'd love to hear from you. Our toll-free number is 1-877-453-5088, and our website is simply caregiversalberta.ca. You can certainly look us up there. Are there any further questions, Paige? Okay, so in wrapping up the session today, again, I want to thank you for joining us. It's been my pleasure to be here. As I mentioned in the opening of today's webcast, this is part of the Government of Alberta's Human Services Learning Series, and it will be running the third week of each month right through till June of 2017. The series covers topics from ABII, like the one you saw today, but the other series talks are about things like Employment First, Fetal Alcohol Spectrum Disorder Initiative, Office of the Public Guardian and Trustee. So stay tuned for the information on next month's webcast. To get these updates and to register for the information sessions, you can email them at abii@gov.ab.ca and ask to be added to the mailing list. You can also find past and future webcasts there and sign up at hslearningseries.ca. So today's webcast, as I mentioned, was recorded, and the video will be posted online in a couple weeks, and it'll be there with the other videos from the previous webcasts that you can view. The video link will be sent out to all registrations in the near future. We certainly encourage you to share this video and the other videos on the series with those people in your life that you know might be interested. If you have any feedback on today's webcast, please let us know at abii.gov.ab.ca. And you'll also be receiving a feedback email from us. So please take the time to let us know what you thought of the webcast. We'd love to hear your ideas if you've got ideas that you'd love to hear in the future. And we hope that you have a wonderful day. And we hope to see you next month as well. So thank you so much for joining me today.